Hello and welcome. Thank you for joining me and others in the ALS community for today's webinar. I'm Eric Johnston and I work on the Access and Reimbursement team at Mitsubishi Tanabe Pharma America, or MTPA. In this role, I oversee the JourneyMate Support Program Insurance and Access Specialist team, our copay assistance, patient assistance, and free trial programs at MTPA. Additionally, my team and I work closely with the specialty pharmacies that dispense and deliver RADICAVA ORS. So on behalf of my colleagues at MTPA, I'm really pleased to be here today and share some information with you about access and insurance coverage for ALS treatments. We truly understand that receiving an ALS diagnosis is devastating. And on top of that, there's a huge volume of information coming at you, whether it's clinical information, logistical information, or insurance information. It's unreasonable to think that anyone could take all this in. In addition, new questions and new information will arise throughout your ALS experience as your insurance coverage or financial means and/or physical abilities change. So our goal for the next 45 minutes or so is to help out just a little bit with some of those questions related to insurance coverage and financial assistance programs, and to share some tools and resources that can help, whether you're newly diagnosed or have been living with ALS for some time. All of the information that you'll hear will come from both me and a couple of your peers who will share their own personal stories of how they gained insurance coverage and assistance for RADICAVA ORS. The information we share, though, will certainly be applicable to other prescription medications as well. Following our main presentation, we'll also have a question and answer session where we'll do our best to address as many questions as we can. And throughout the presentation, we encourage you to submit questions. If you're viewing on a desktop, you can enter a question in the black box on your screen, or if you're on a mobile device, simply click the question mark icon at the bottom of your screen to submit your question. Now, before I introduce you to our other speakers, I wanted to share a few disclosures about today's program. This program is sponsored by MTPA, and I'm an employee of MTPA. And while our speakers today are not MTPA employees, they are being compensated for their time. This session is not intended to provide medical advice, so we always encourage you, please talk to your doctor before making any treatment decisions. Now, as I mentioned today, we'll use an example of RADICAVA ORS to highlight the process for gaining insurance coverage and exploring potential financial assistance programs which may help your out-of-pocket costs. Now, RADICAVA ORS, or edaravone, is approved for the treatment of ALS. We aren't going to spend any time reviewing the RADICAVA clinical trial data today, but if you're interested, there are other webinars available and on the RADICAVA website that you can check out. In addition, important safety information for RADICAVA ORS is listed on this slide here, and the full important safety information will be displayed at the end of our presentation after our Q&A session, or can be found in the helpful resources section. Now, I have the great pleasure of introducing our speakers. First, I'd like to introduce Chris Spaulding, who was diagnosed in 2024 with ALS and has since become actively involved in advocating for access to care for people with ALS. We're also joined today by Jayme Floyd, whose mother, Jana, was diagnosed with bulbar onset ALS in 2023 and has been integral in advocating for access for care for her mom's needs. So welcome, Chris and Jayme.
Thanks for having me, Eric. It's really great to be here.
Yes, thank you. It's great to join this conversation.
Thank you. I've been looking forward to today's session as well. So for our attendees throughout the presentation, please feel free to use emoji reactions so that you can find at the bottom of your screen and show your appreciation and support. So Chris and Jayme, why don't we start by having you each tell us a little bit about yourselves.
Yeah, thanks, Eric. As you said, I'm Chris Spaulding, and I was diagnosed, unfortunately, in June of 24 at the age of 66 with ALS. I live in Spring, Texas, which is just outside of Houston, with my wife, Andrea. We have two kids who are in college. And I also have a son from a prior marriage. I'm happily retired after over 40 years of working in the oil and gas exploration and production business. And over the course of time, I had the opportunity to live and work in 9 different countries on 5 different continents. And I still enjoy traveling. My wife is from Argentina, so we spend quite a bit of time down there.
Great. Jayme.
Great, thank you. Hi, everyone. My name is Jayme Floyd, and I live in California near the beautiful Joshua Tree National Park. But I spend several weeks a month in Nevada with my mother and my family there, who my mom is living with ALS. Previously, I did have an exciting career in sales and marketing with NBA and NFL teams, but now I have the even more exciting and challenging job of being a full-time stay-at-home mom to my 1-year-old son. My husband is also a first lieutenant in the Marine Corps. So like Chris, our family loves to travel. We also move around a lot, obviously. And we are big fans of all types of sports. And fun fact, last year, I got to go with my cousin and my husband and my mom, and we took a trip to the Daytona 500, which was super memorable for us all.
Great. Well, thank you both so much. We really look forward to learning from you throughout this webinar. Now, our session today is going to focus on your personal experience accessing RADICAVA ORS, but truly the first step to accessing any therapy is aligning with your doctor to make sure it's right for your treatment plan. So Chris, let's start with you, please. What drove you to want to start therapy with RADICAVA ORS?
So look, when I was diagnosed with ALS, I immediately began working with my doctor to make sure I was doing everything I could to face this disease head on, including getting access to the only 2 currently FDA-approved drugs that are available for treatment for sporadic ALS, those being riluzole and RADICAVA ORS.
Okay. Jayme, was this like your mom's experience of starting RADICAVA ORS?
Well, unfortunately, my mom's initial doctor wasn't as proactive in sharing information about treatment options. She actually received her ALS diagnosis over the phone, not even a video call. And then they were just like, we'll see you at ALS clinic. And we were very new to this. We were like, what the heck is an ALS clinic? So really looking back at the time, it was pretty traumatic. But the absence of information then, it drove me into action. I learned about RADICAVA ORS through my own independent research, and then by connecting with my mom's local ALS Association chapter at the time. But like Chris, once we learned about RADICAVA, we thought it was very important for us to get my mom started on it as soon as possible. We really didn't want to wait. It felt important to be doing anything and everything we could to help slow her progression. So I can proudly say that I was a nuisance to everyone involved. I was nonstop messaging and calling the doctor and insurance until we were able to determine it was the right treatment for her. And we got that process started to get her access to RADICAVA ORS.
Thank you for sharing. It sounds like the decision to try RADICAVA ORS wasn't a difficult one after speaking with your doctors. And for many, getting insurance coverage for RADICAVA ORS isn't difficult either. So I want to take some time to highlight the common steps required to obtain insurance coverage for RADICAVA ORS, as well as some tips to make this process go as smoothly as possible. Before I do so, I very quickly want to review the different types of insurance that may be available to you. Your type of insurance will impact what the coverage determination process may look like. It will also impact your out-of-pocket costs and the resources available to you to support these costs, which we'll talk about in the second half of this session. So starting on the left hand of the slide here, the first option you may have is commercial insurance. This is insurance that is provided and managed by private companies. Others in the webinar may be on Medicare, and ALS patients are eligible for Medicare within the first month of receiving their diagnosis. They do not have to wait 2 years or until they turn 65 as some other patients do. Medicaid can provide insurance coverage for people meeting income, asset, and other state-specific eligibility requirements. And some people may be considered dual eligible, which means that Medicaid may help with some Medicare-associated costs. And lastly, I would be remiss if I didn't mention coverage provided by Veterans Affairs benefits or active military, DoD. In all cases, your plan may have a separate pharmacy benefit manager or PBM. And that PBM manages prescription drug benefits on behalf of these plans. The PBMs play a major role in determining drug coverage, which pharmacies you can use, and even the patient-specific out-of-pocket costs. So every insurance plan is a little bit different, so it's always critical to look at your plan's requirements. But pretty much no matter what type of insurance you have, you and your doctor will likely need to get special permission from the insurance company before you can access RADICAVA ORS. To be clear, it's not just RADICAVA ORS that has this requirement. In fact, most specialty medications that are used to treat complex or chronic or rare conditions will require prior authorization and approval from insurance. Your insurance may refer to this requirement as a prior authorization or an exception request. And typically your doctor will be asked to complete some forms on your behalf and provide information on you, the drug, the treatment objective, essentially building the case that the medication is medically necessary for your care. Unfortunately, the time it takes for insurers to review these requests may vary, but there are a few things that can be done to help your review go as smoothly as possible. So first, the review, first, you review the specific coverage criteria for your insurance with your physician to make sure that any required documentation is submitted with the initial request. For example, insurance may require your doctor to submit an ALS FRS score or your forced vital capacity, known as FEC1. Make sure your physician is doing any tests and submits any documentation required by your insurance provider with your initial request for coverage approval. If the required documentation is not submitted with the initial request, then the insurance may initially deny coverage for the process, deny coverage, and the process for approval will take longer while you go through the insurance provider's appeal process. Second, when your provider submits the request, it may be possible to request an expedited determination, meaning that a delay could jeopardize a patient's health. Virtually every plan offers these, so ask about the process for an expedited review for your plan. Third, we recommend to take the time to understand your plan's pharmacy network. Sometimes, if a physician sends a prescription to an out-of-network pharmacy, this can be more costly for you or it may delay the time to fill. Remember, drugs like RADICAVA ORS are not filled at local pharmacies, but rather at specialty pharmacies that are equipped to handle drugs with special storage and handling requirements.
So Eric, in my mom's case, I remember her healthcare team said she had to be stable on Riluzole for 30 days before they prescribed RADICAVA ORS. So is this commonly required?
So it's a great question, Jamie. Sometimes insurance will require that, but usually this is not an insurance requirement. It may be your physician's preference or recommendation to start both medications at the same time. It can be quicker to get Riluzole because it's available at your regular pharmacy and generally won't require pre-approval. Or some physicians, some physicians may start this first, but people interested in starting any specialty medication should definitely ask their doctor about starting the prior authorization or exception request process as soon as possible. Again, to be clear, this is not RADICAVA ORS specific issue, but something that's typical for many medications that you must order through a specialty pharmacy.
Good to know. Thank you.
Thanks for asking. So in many cases, the prior authorization or exception request will be approved. In others, it may be denied, but that doesn't have to be the end of the road. Instead, the next step for you and your provider will be to submit an appeal. Plans will each have specific information and requirements to support the appeals process. And in most cases, the appeals process is progressive, which means that there are multiple levels of appeal. Typically, plans have up to 5 levels of appeal. I appreciate that the prospect of exceptions followed by multiple appeals can sound quite daunting, but it is something that you should not be afraid to take on. There are multiple resources and individuals who are available to help if you end up in this situation, including the program offered by MTPA called JourneyMate that we'll talk about in just a little bit. So I'm going to now invite Chris to share his access story and why he found RADICAVA ORS was worth fighting for.
Thanks, Eric, and great for that background. So look, my access story really started at the time of my diagnosis in June of 2024. Like I said, my doctor and I decided to move forward with starting treatment with riluzole and RADICAVA or ORS. My doctor told me that I needed to be on riluzole for 30 days prior to submitting a prior authorization for RADICAVA. And he didn't anticipate difficulties getting insurance coverage for riluzole, and that proved to be the case. But they did say to me, look, coverage for RADICAVA can sometimes be difficult. People whose symptoms are further progressed. But, at that point, I was, very strong, and the progression of my ALS was quite limited. So, my doctor thought, hey, we're going to be successful in getting me coverage for RADICAVA ORS.
So what kind of insurance did you have at the time, Chris?
So I was insured, and then and now through Medicare Part A, Part D. I receive my medicine through a pharmacy benefit manager, pharmacy benefit managed company, or what's called a PBM. My doctor needed to submit a prior authorization to the PBM. And unfortunately, that prior authorization for RADICAVA was denied. And then doctors, they immediately sent in an appeal of that denial, and that appeal was denied. So then I took the matter and I appealed to an outside independent panel that Medicare uses for a situation like this. Sure enough, the outside panel agreed with the PBM, and they denied me coverage for RADICAVA as well.
Did they give you any reason for this denial?
Yeah, they did, and the reason was rather shocking. The PBM and the insurer basically asserted that my ALS had progressed too far for them to cover the drug under their policy. Specifically, the denial letter that I received when I was told coverage was denied said the following, and I'll quote on this, quote, because it was not confirmation that you have a score of 2 points or more on each item of the amyotrophic lateral sclerosis, ALS functional rating scale, revised, ALS FRSR, which shows that you have retained most or all activities of daily living, end quote. I was rather stunned on this. My total ALS FRS score at the time was 42, and the best you can do is 48. So, that indicated that my ALS had not progressed much. So I went back to the clinic, to my doctor, to try and understand which of the categories, the 12 categories in the ALS FRS system, I scored below a 2 on. And, speaking with a clinic, I learned that the issue came from the fact that I reported that I use a handrail when I go up and down stairs. Gave me a score of 1, according to the PBM, on the ALS FRS for the scale, for the category of ability to climb stairs. But I mean, my doctor had advised the PBM and the insurer that in writing they did this, that I did not need to use the handrail for reasons of my ALS, but I do so for, personal safety reasons.
Mhm.
So, when I came to understand things, I said, well, look, wrong, this is absurd. I don't need to use the handrail, but I do so and have always done so because it's a safe, smart thing to do, as millions of people perfectly healthy do every time they go up and down stairs.
Yeah, I mean, that must have been really frustrating. I'm sorry that you got that response from your insurer. I mean, your rationale sounds very reasonable to me. So what did you do once you learned that this was the reason for the denial of both the initial request and the appeal?
Yeah, the first thing I did was I sat down and wrote some letters. And
Hi, we have a slight pause in the presentation. Just give us a moment so we can continue to move forward.
hugely supportive. And, they encouraged me to keep fighting and to take the next step in the process, in the appeal process. And that would involve going in front of an administrative law judge in a legal hearing. I wasn't really sure I wanted to do this. Getting into legal matters, that's generally not much fun. But the coverage decision was so arbitrary and so unfair. And the ALS Association folks, they were willing to help. Their help was really integral because I was getting worn down. I was starting to get tired. But when I spoke to the ALS Association, but take the next step. We'll help you. And you have a really good case. The ALS Association said, look, one of the things that happens is that people get worn down in this process and they often give up. And I think that's one of the things that the insurers may bank on. So, frankly, it's not my nature to give up. And so with all this encouragement, I said, okay, we're going to do the appeal. I did this for myself, selfishly, but I also did this, thinking it could make a difference for others in the ALS community.
Can you tell us a little bit more about that process, Chris?
Yeah, so, the ALS Association folks, they coached me along, and I found that the administrative law judge process really was not that much more complex than the other steps. I had to fill out a 2-page form requesting a hearing with an administrative law judge. I asked for the hearing on an expedited basis, and the hearing and the expedited basis they granted. Now, getting an expedited hearing was important, because at this point, I was like 2 months delayed, excuse me, in starting RADICAVA. So the hearing took place the following week. It was done over the phone. I didn't use a lawyer. I handled it myself with the ALS Association folks. They're supporting me. I went through my testimony, to outline, the reasons why, I use the handrail. I have this disease. I need the drug. And, then they said, well, look, they're saying I'm denied because of using the handrail. But that wasn't a new habit for me. You know, that's something that frankly had been drilled into me for, you know, by my employer for safety regulations, you know, through 40 years of working. But the other thing that I did, and I think this was key, I recorded a video and put it on YouTube.
We seem to be having some technical issue with Chris.
Chris, I'm sorry. We heard you say, Chris, I'm sorry. We heard you say that you recorded a video, but then it paused after that. Well, you recorded a video, you said?
Yeah, I recorded a video and put it on YouTube. And that video showed me going up and down stairs without touching the handrail. I sent it to the PBM and I sent it to the insurer to show them, hey, I don't need to use the handrail. I also included that video in the evidence that I sent to the judge.
I mean, that sounds convincing to me. Did it convince the judge?
Well, look, so after I went through the process and stated my case, the judge then turned to the PBM representative for their position. And they immediately backed down. The representative of the PBM said, look, based on the video, their position had changed and that coverage for RADICAVA ORS would be provided. You know, so they were saying, oh, well, we have this video and, you know, that shows, you know, that he qualifies for the drug. But the thing, Eric, that, you know, really, I don't think was too good. They had that video. They had that video long before the hearing, and I guess they just ignored it. So, you know, after that, you know, that was it. The hearing was basically over. 3 days later, I get, you know, my first dose of RADICAVA, you know, and off we go. You know, getting the RADICAVA was, you know, that was pretty uplifting. You get this, you know, you get this terrible diagnosis, you know, a disease that's 100% terminal right now. But at least now I thought, okay, I'm doing everything I can to try and slow down the progression. And getting the RADICAVA, you know, gave me an additional measure of hope. You know, there's a heck of a lot of things that I still want to do.
Well, thank you for sharing your journey, Chris. It's so brave that you took this on, and I truly appreciate your sharing your experience and to help inspire others that keep pressing forward, and even in the face of potential obstacles. So if you don't mind, if I could summarize, I think there's probably 3 key learnings from your experience. So first, start early. Insurance coverage is generally easier when RADICAVA ORS is prescribed soon after diagnosis. As your story so pointedly illustrates, some insurers will only provide coverage for people whose symptoms are less severe at the time they start treatment. And several prominent insurance companies require that anyone seeking RADICAVA coverage score at least 2 points in all 12 areas of the ALS-FRS scale, amongst other benchmarks. Second, appeals can be successful. You know, according to the Kaiser Family Foundation, for example, of the 46 million prior authorizations for drug coverage submitted to Medicare Advantage insurers in 2022, 3.4 million were initially denied. Just 1 in 10 of those denials were appealed. However, in cases where a physician or an individual did move forward with an appeal, the denial was overturned more than 80% of the time. Which brings me to my third point, which is if you take it step by step and enlist the support of others who have done this before, the process for obtaining coverage is not as overwhelming as it may seem at first.
So, look, Eric, I think that's a really good summary of things, and the reason I wanted to be here today is to share my story with anyone who might be in a similar position. Don't get worn down. Keep pressing on. Initially, I was, quite discouraged, but
Take your time, Chris. Take your time.
I wouldn't give up. And in the end, with the help of the ALS Association, I was able to prevail, and it is important. But with ALS, I have to live with hope. And the RADICAVA gave me more hope. I'm sorry.
You're doing just fine. Thank you for sharing. So, it sounds like you mentioned advocacy groups, and I wanted to mention advocacy groups do play such an important part. They're an important resource for people living with ALS for so many things. And another resource that can help for anyone who's considering treatment with RADICAVA ORS is MTPA's JourneyMate support program. JourneyMate is a free resource that gives you the understanding, answers, and resources to help you move forward. You just need to reach out and speak with a JourneyMate insurance and access specialist. They can help you investigate your insurance coverage and health plan benefits, answer questions, and let you know what's needed next at each step of the process as you pursue treatment, including any exception requests or appeals. And they can introduce you to RADICAVA ORS financial support options that may be available to you. Jayme, was your family able to work with JourneyMate to help your mom's access to RADICAVA ORS? Can you tell me a little bit about that experience, please?
Yeah, of course. So my mom had to figure out her coverage and access to RADICAVA ORS 2 times, actually. So once when she was living in California, and then once she moved to Nevada. So the first time we really didn't know about JourneyMate. And I will tell you that the process was frustrating, not quite as challenging as Chris's experience, but it certainly felt like I was on the phone with the insurance company and the doctors multiple times for multiple hours. The process ended up dragging out for weeks to probably over a month, actually, and it definitely delayed my mom's start on RADICAVA ORS. So when my mom moved to Nevada, the clinic there, the ALS clinic there in Southern Nevada, had already worked with JourneyMate multiple times in the past, and they connected us right away, like instantly. So let me tell you, the process, it just could not have been more different. It was super easy, and we were actually felt like we were being taken care of. We didn't have to make any of those annoying calls like we had before back in California. And both the team at the ALS clinic and the JourneyMate team let us know what information we needed to get the process going. So yeah, they worked with my mom's doctor's office and the office staff there to make sure that they understood the steps needed to take to submit that prior authorization form for the drug. And my mom was able to continue her treatment without a hiccup during that move. So after insurance was confirmed, we worked with an ALS clinical educator who then reinforced what my mom's doctor had kind of already shared about the medicine, like how to take it, how to store it, things like that, and could answer any questions my mom had. they actually came to the house. It was a nice visit. So yeah, we did feel fortunate that our worries were put at ease that next go around, because the people from Journey Mate really cared. When, you know, even back in California, we didn't really know what was going on. So it's good to feel like people are in your corner during this journey.
Well, I'm so glad that you and your mom connected with Journey Mate and easily navigated coverage for RADICAVA ORS. And of course, getting coverage is only part of the equation. The other key piece is how much you'll pay out of pocket for a covered drug. Coverage doesn't mean patients and families will have no cost for medication. Instead, out-of-pocket costs for any medication are determined by your plan's benefit design, including your deductible or copay or co-insurance, and an out-of-pocket maximum. Critically, I do see lots of people who are getting tripped up through what I call false math when they look at their benefits. They're told that their cost for the first month of RADICAVA ORS is, for example, $2,000. So they multiply this cost by 12 and think that they'll be paying $24,000 a year for RADICAVA ORS. It's understandable why they do this, but it's generally not the case, as your total payments are going to be limited by your out-of-pocket maximum.
Yeah, Eric, that is such an important point. Sometimes I see people online who are asking or saying this medicine costs so much. Do I really need to take it? You know, is it really worth it? And in an ideal world, you know, none of us would ever be debating if a medicine is worth it based on cost alone. But in this case, the main point I'd like to make is, you know, you really need to dive in a little bit deeper to understand what the actual cost will be for you. So, for example, my mom has commercial insurance coverage, and so that means she met all the eligibility requirements for MTPA's out-of-pocket assistance program. So she was able to work with Journey Mate to reduce her out-of-pocket costs. And then when she maxed out that benefit, we then worked with a third-party foundation who then covered a lot of her remaining costs before hitting, before hitting her out-of-pocket maximum.
Well, thanks for bringing that up, Jayme. There are multiple resources that may be able to help with out-of-pocket costs, but these resources will be different depending on whether you have government paid insurance or commercial insurance, or if you're uninsured. So the Journey Mate team can share more specific information specific to your situation, but at a high level, if you have commercial insurance, you may be eligible for MTPA's out-of-pocket assistance program, like Jayme's mom is. By contrast, MTPA is prohibited by federal law, unfortunately, to provide this same support for people enrolled in government healthcare programs. Luckily, there are independent third-party foundations like HealthWell or the Assistance Fund or the ALS Association Assistance Program that may be able to provide support. These funds may also be available to support additional costs for people with commercial insurance. And finally, for those without insurance coverage, for RADICAVA ORS, MTPA offers a free drug program for those who meet income and other eligibility requirements.
Oh, wait, that's interesting. So my mom decided to stay on commercial insurance because she was worried about the out-of-pocket costs for her medication. And she knew that programs like the copay program offered by MTPA would not be open to her if she moved to Medicare. But it sounds like there still may be funding and help available no matter what kind of insurance you have.
Yes, yeah. I also want to highlight an important change in Medicare Part D that's taken effect in 2025. Specifically, in the beginning of this year, there's no more donut hole or coverage gap phase for your prescription drugs. Instead, there's an annual $2,000 out-of-pocket cap on prescription drugs. And once you reach this limit, you will pay zero out-of-pocket for the rest of the year. So what counts towards this $2,000 out-of-pocket maximum may vary based on your Medicare Part D plan structure.
That's definitely something to look into. Thanks, Eric.
So we're going to move into our question and answer section. So please continue to submit your questions through the platform. While people are submitting questions, I want to remind you that you can find this information that we've reviewed today on RADICAVA ORS website. The information is also available by clicking on the links available at the right side of your screen for people on a desktop, and by selecting the paperclip icon for individuals joining us on their mobile device. I also want to see if Jayme and Chris have any final thoughts or recommendations. So Jayme, why don't you go first?
Okay. Yeah, so but I'd just like to share that before you try to figure it out on your own, and before you start making all those calls like I did to insurance and to the doctor, make sure you talk to people who have been through this before. You can lean on JourneyMate, and you can lean on your local advocacy organization like ALS United or the ALS Association, and you can ask them if there's anything they can do to help, if they can help with those calls, or if they know the process a little bit better. And you may also feel very alone, and especially in the beginning, that diagnosis is very traumatic, but you don't have to do this alone. And unfortunately, there have been people who have been in your shoes before as well. So it's important to lean on that community.
For sure.
Yeah, I mean, Jamie's spot on that. A lot of other people have been through this before. And there are organizations, the ALS Association, I Am ALS, and on and on. They'll help you. So, as you're going through this, if you're getting denied, try not to get worn down. Just hang in there. Do your best. You got to go through the process, because I really think, it's really worth it to know that, you're going to be doing all to fight ALS, which is obviously a cruel disease.
Yeah, for sure. Thank you for that, both of you. And with that, we'll take our first question. But just a note before we start with the question and answers, I wanted to mention we cannot address any specifics of individual health plans or costs or coverage on this call. For any financial or insurance questions that you may have, we encourage you to contact NTPA's JourneyMate support program. So for our first question, Chris, this is for you. Looking back at your journey, what do you know now that you wish you had known then? Would you have done anything different?
Done anything different? No. I would have gone through the process. Would have fought. What I wish I knew then that I know now, how important the ALS FRS 12 points in the rating system are in determining for many insurers whether or not you'll qualify for RADICAVA coverage. So, for instance, the question was a question of, do I use the handrail when I go up and down stairs? And to me, I wish I had realized the question really was, do I need to use the handrail? Or can I go up and down stairs without the use of the handrail? That to me, was, now looking back, that to me was the real question, not whether I use the handrail, which again, millions and millions of people, perfectly healthy, do that every day as part of daily living activity.
That makes a lot of sense. Thank you, Chris. Jamie, our next question that came in is for you. Are there resources specifically for adult children of people living with ALS that you found to be helpful?
Hi, yes. I took some notes actually, I wrote in case anyone asked these. So I would like to start, like I mentioned before, obviously your local advocacy group. So that's going to be ALS United or the ALS Association, depending on where you live. For my mom, that's ALS of Nevada. I don't know what you would call her, either the coordinator or the manager of that group. She's very active, I guess, for lack of a better term, within our family. And she's someone who I can even text back and forth. So if I ever have questions, she's someone I can lean on. So I would always start there. And then some other great organizations I found in the beginning to help me learn more about the disease and just like the whole scope, like the whole of everything. I really liked I Am ALS. just to go to that website, and they have drop downs, and you can like select, what role ALS plays in your life, and it can kind of direct you from there so you can have a better understanding of it. And then a third resource I really like, Compassionate Care ALS, or CCALS. So like the local advocacy groups, and like I Am ALS, CCALS also has monthly like online, I'm forgetting the word for some reason, like support groups, I guess, for lack of a better term. CCALS specifically has ones for sons of ALS and daughters of ALS, both targeted towards adult sons and daughters. Because there's like groups for younger children as well, like Hope Loves Company, but it's a different experience as an adult child versus a young child. And then lastly for me, something that I always like, I always like to look for hope for my mom, and like some learn about new research that's happening. So I stay tapped into ALS TDI and ALS Today to kind of like stay up to date on different news. And those are both like reliable sources of news to kind of provide some hope for looking for a cure.
Thank you. Thank you. I'm glad you found so many resources that are helpful for you. Our next question for Chris. Chris, it was asked, do you think that RADICAVA ORS is helping you?
So I'm going to answer that in two ways. First of all, I'll answer that from what I'll say is, a mental situation. Mentally, it's lifting. I feel like I'm doing all that I can from a drug perspective to fight back against the ALS. So, from the state of mind, it's been really helpful. I have a doctor who's telling me you should have this, and now I've got it. And the second part, one of the neurologists I'm working with has told me that my ALS is progressing slower than what he would have expected to see, and quote, what he says is typical. So, I just take that at face value. And, I'm just really glad I fought for and now have, RADICAVA in my arsenal, fighting back against the disease.
Thank you, Chris. I definitely appreciate you sharing that. We have another question for you, Jayme. What are some ways that you support your mom when you're out of state or away from her?
Cool. Good question. I think for me, top of mind is to still maintain that strong relationship. Obviously, it's easy for me. My mom is my best friend, but finding new ways to communicate. We can't talk on the phone anymore. She has lost her ability to speak with her voice, but we can still text, and we can get on FaceTime together, because Apple actually has like some disability features, so she can talk to text or use her speech assist app on her phone, so we can FaceTime. And we watch shows together. Right now we're watching Ginny and Georgia on Netflix. Even though we're not together, we can still kind of have an activity to do together. But personally, I also like to feel like I'm contributing even when I'm not there. So kind of like I mentioned before, I stay up to date on any like clinical trials or expanded access programs. My mom was enrolled in a clinical trial that's now completed. So now I'm searching for an expanded access program to get her into. And I also kind of step into like that administrative or office assistant role, I guess, because I'm not there. I can't help with the day-to-day, but I can, call the doctor's office for her, or I can make sure her medication's being refilled, and just, do things like that. And I think lastly, I like to be the fun planner. I like to, always have something fun planned for when I visit, big or small. And I have used Team Gleason, like I mentioned, so that's a great resource for people to use Team Gleason for an adventure. That's how we went to the Daytona 500. And Yeah, another, you can also have a grandchild. My mom was really happy about that when I did that. That was great for our FaceTime dates.
That's wonderful. Yeah, she sounds really lucky to have you in her life. I thank you for sharing all of that. We do have another question here. This is for me. Does straight Medicare and Part D pay for RADICAVA ORS? So generally speaking, it is covered by Medicare, but as far as your specific coverage, it's really going to depend on the insurance that you have. By straight Medicare, I'm assuming Medicare, more traditional Medicare is what's meant. Part A, Part B, and Part C, and Part D, as a reminder, are the 4 different types of Medicare. Part A and Part B do not pay for RADICAVA ORS because those are medical benefits, and those would apply to your hospital visits or your doctor services. Part C and Part D could potentially cover Medicare, but again, it's going to depend on your specific plan that you purchased. So the best way to find out would be to reach out to your plan, to reach out to your JourneyMate support program, to ask for assistance in understanding your benefits for your specific plan. Again, that would require your physician writing the prescription and enrolling you into a JourneyMate support program. So I'd love to answer that for everybody, but it really depends on your specific plan. There are resources to help you find out what that is. We had another message come in. Chris, this is a message for you. Someone commented, PBA is tough. Hang in there, Chris. We're all in this together. So I wanted to make sure that you heard that.
Great.
So this is not a question, but one of the participants wanted to thank his friend Chris for sharing his experience. All his friends in Argentina are spiritually with you. So thank you so much, Jayme, for sharing your experience as well. That's a nice note that came in we wanted to share. Do we have any other questions at all? Okay, we have another question coming. Just a moment, please. And thank you to everybody that's asking questions. We really appreciate your input and your participation. Thank you. Okay. The question is, my plan refused to call JourneyMate, and JourneyMate said they weren't allowed to call the plan. We felt stuck. Any thoughts? So if your plan is refusing to call JourneyMate and JourneyMate is not allowed to call the plan, we don't want that to slow down your progress in getting coverage, right? One of the things I want to mention is when your physician enrolls you in the JourneyMate support program and sends in a prescription to the JourneyMate support program, they're there to help you understand your benefits and to help you understand what the specific coverage is available for you and help you understand your options and what the facts are relevant to your situation. However, the JourneyMate support program will also take the prescription that was written by your physician and forward it on to the pharmacy that is your in-network pharmacy, a pharmacy that will also be able to work to get coverage approved with your healthcare provider. So if your specific insurance plan refuses to work with JourneyMate, they should work directly with you as the beneficiary, and they should work directly with your specialty pharmacy. So even if JourneyMate is not able to work with your plan, they can always work with you as a patient or a caregiver. And it's perfectly fine to ask them questions about general insurance coverage, or what are some questions and what is some information that you may need to know. And then, unfortunately, for a plan that refuses to work with the support program, it might have to be yourself or your loved ones or your specialty pharmacy or your doctor that asks these types of questions directly to your plan. But hopefully we can get you pointed in the right direction with your specific plan. At the end of the day, we want to make sure that you understand what your options are, that you have accurate information, and then just work to support whatever choices you make. Okay, one more question. Can I have RADICAVA and Riluzole at the same time? So this would be something you definitely would need to ask your prescriber. I will tell you that it is not uncommon. In the clinical trials, there were patients who were on both, but as far as whether you should have both products, that's something you need to discuss with your doctor, because that's a clinical decision that your physician and yourself would have to make.
So Eric, if I could say, I personally am on both drugs. I personally am on Riluzole and RADICAVA ORS.
Great. Thank you, Chris. I have a question that is directed for both of you. I'd love to get both of your thoughts on this. What resources have you used to evaluate different insurance cover options, different insurance coverage available to you? Chris?
Well, I get my insurance through Medicare, but then also a retiree program from my employer that has an agreement with a private. So that's how I get my Medicare Part D. You know, I did some evaluation on my own. I talked to some, you know, the ALS Association folks about that. You know, for me, the Part A, Part D combination that I have, once I got over the battle of getting coverage, you know, that was best for me. And you mentioned, you know, for instance, the $2,000 out-of-pocket maximum for drug coverage. That applies to me, you know, under my Medicare Part D plan. So I have to say that once, you know, I prevailed in the battle of getting coverage, you know, it's worked out pretty well. So, I mean, everyone has to, you know, obviously evaluate what their own options are and what's best for them.
Thank you, Chris. Jayme?
Eric, can you just clarify what you asked one more time? You cut out a little bit.
Sure. I was asking, what resources have you used to evaluate your different insurance coverage options or for your mom?
Oh, okay, great. Yeah. So I guess I could specifically talk when she did obviously switch insurances from moving to California to Nevada. We started with the marketplace. It's just the government website for Nevada to see what plans were available to her. And then from there, I looked at each insurance provider, and I believe the term is called formularies that shows all of their drugs that they cover. So I looked up each of those to make sure RADICAVA ORS, among her other medications, were covered on those. And then from there, I also knew, coming from California, that these drugs that she needs come from specialty pharmacies. So for us, it was preferred to find an insurance company that had their own specialty pharmacy to kind of like take out an extra layer, because they're through this journey, you find there are so many people you get ping pong between. So that's how we settled on what the best one was for her. Yeah.
Great.
I think that answers
Thank
the
you.
question.
Yeah, definitely. Thank you for sharing. I appreciate it. So these have been some great questions, and I hope that everyone listening today learned at least one new thing from our conversation. Remember, don't give up. You know what's right for you. So it's important to take advantage of every support and don't stop until you get what you need. Please stay connected for the full prescribing information, full important safety information for RADICAVA ORS. And thank you all again for your time and your attention. I hope you all have a great rest of your day. Thank you.
Indication: RADICAVA ORS, edaravone, is indicated for the treatment of amyotrophic lateral sclerosis, or ALS. Important safety information. Do not receive RADICAVA ORS, edaravone, if you are allergic to edaravone or any of the ingredients in RADICAVA ORS. Before you take RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant, or plan to become pregnant. It is not known if RADICAVA ORS will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if RADICAVA ORS passes into your breast milk. You and your healthcare provider should decide if you will receive RADICAVA ORS or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of RADICAVA ORS? RADICAVA ORS may cause serious side effects, including hypersensitivity or allergic reactions, and sulfite allergic reactions. Hypersensitivity reactions have happened in people taking RADICAVA ORS and can happen after your medicine has been taken. RADICAVA ORS contains sodium bisulfite, a sulfite that may cause a type of allergic reaction that can be serious and life-threatening. Sodium bisulfite can also cause less severe asthma episodes in certain people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itching, or an asthma attack in people with asthma. Your healthcare provider will monitor you during treatment to watch for signs and symptoms of all the serious side effects and allergic reactions. The most common side effects of RADICAVA, edaravone, and RADICAVA ORS include bruising or contusion, problems walking or gait disturbance, and headache. These are not all the possible side effects of RADICAVA and RADICAVA ORS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch or Mitsubishi Tanabe Pharma America Inc. at 1-888-292-0058. Please see full prescribing information and patient information at radicavaors.com.